Last year on September 13, I had to have shoulder surgery, and that surgery, the consultation was $300 and the actual surgery was $7,000. I'm glad I went to the private sector because they gave me a new lease in life, and they can teach a lot to the non-private sectors on how things are done. But I've also had to give up summer vacation and winter vacations because the cost alone on my visa was very high. When I needed the shoulder surgery, I had gone to many doctors. I went to one doctor by the name of Dr. Fish at the Montreal General, and I sat in the waiting room for 7.5 hours for Dr. Fish to come out and say, well, poor you. You know what? I don't do this type of surgeries anymore, so why don't you just go home? I was so frustrated. Then my rheumatologist sent me to Dr. Bowman. Well, this doctor looked at me and she says, how old are you? I said 64. She says, well, you're way too old to have surgery. Let me give you a cortisone shot. And I said, no, because I've had 4 during the year and they don't work. I paid $70 for a shot that didn't even last a week. They're pushing you towards a private service. What do you do if you don't have the money to pay these very expensive private surgeon? You either pay the surgeon for the surgery, then you can pay your medication. If you pay your medication, then you can pay your bills or eat. So where do we stand here in Montreal? I think the government is wrong in doing what they're doing. It's basically telling the public, you can't afford it, well, just croak and die. I'm sorry, this is not acceptable.